Public health feels hard right now. Maybe you've been laid off. Maybe you're burnt out. Or maybe you're watching your funding dry up. Or maybe even you're questioning why you entered this field in the first place. You're scrolling through LinkedIn and seeing nothing that feels like a fit for you. You listen to national priorities shift away from equity and from health justice. You feel disconnected, defeated, like you're losing part of yourself. You're not alone, and you're not wrong for feeling this way. Hey everyone, Omari Richins here, founder and CEO of the Public Health Millennial, where we help you navigate public health. This work is heavy and it's personal. Working in public health, oftentimes we carry that work more than other jobs. Let's say a plumber or electrician, because we know that our work is so meaningful and it changes lives. And this work was never meant to be a solo mission. And yet, so many of us carry this as a personal burden. We hold on to this personal weight. Our identities get tangled in our job titles and roles. Our self worth gets tied to our impact. And when we lose that job, that grant, that structure, we start to feel like we're losing ourselves. I've been there. After completing a 12-month fellowship, I was told there would be a position for me. I felt secure. But then the COVID-19 pandemic hit, leadership changed, and the job suddenly disappeared. My fellowship was extended for 3 more months, thankfully, but I was on my own to find my path forward. I felt disoriented, if I was being honest. Was it me? Was I doing something wrong? It took time and hope, but I landed something new. Still, that moment taught me a lesson I'll never forget. The system may shift, the jobs may vanish, but your purpose doesn't leave you. There's work aligned out here for all of us. 5 ways to stay in public health without losing yourself. This moment might feel like an ending, but what if it's an invitation to reframe how you think about your place in public health? Number one, redefine what success means right now. Success isn't always a job offer or a LinkedIn announcement. Sometimes success is surviving or just getting through this day and this week. It's making space to grieve what didn't work. It's resting without guilt. Take that rest. In a field that often rewards burnout, reclaiming your time is revolutionary. You are not less valuable because you're in transition. Remember that. Two, ground yourself in the mission, not the institution. Many of us were drawn to public health because we care about people, about equity and justice, and about making a change in the communities and people's lives. That mission is very much still alive. Even if institutions fall short, you don't need a specific job title to live out your values, to live out the work that you feel most aligned with. The mission didn't fail. The structure around is just cracked a bit. Number three, use your public health skills in unexpected places. Public health is everywhere, and so are the opportunities. You can bring your training into tech, philanthropy, community organizing, education, corporate wellness, or even policy. Your degree and experiences aren't wasted, they are adaptable. You are not stuck, you are skilled. Number four, process your loss before you pivot. Losing a job, changing directions, or walking away from a toxic work culture is grief. Don't bypass it, embrace it. Make time to reflect on what you've learned, what you've outgrown, and what you still need. Burnout doesn't mean you're broken, it means something needs care, something needs to change. Five, rebuild community around you. Don't isolate. Join communities that understand your journey. Find mentors. Host a virtual meetup. Text a colleague or a friend. You're not meant to carry this work alone. You're more likely to stay whole when others remind you that you already are. When the world feels heavy, when the systems feel broken, when the job doesn't come through, you still belong here in the role and in the work in public health. You can honor your calling without sacrificing your peace. You can pause without quitting. You can pivot without shame. Public health needs bold, human hearted people, but it doesn't need you to burn out to prove you care. This field needs you, but it also needs you whole. We need people who care deeply and see the big picture. People like you. Even when the world feels heavy and the systems feel broken, you still belong here. But you don't have to lose your joy, your identity, or your health to prove you care. You can honor your calling without burning out. You can pause without quitting. You can pivot without shame. Public health needs your heart, not your exhaustion. A reminder to public health folks, your mission in public health is still worthy. This is a hard season, not your whole story. You are not falling behind. You are finding your pace. It's okay to be unsure. Doubt doesn't disqualify you, it makes you human. You are more than your job. Your worth is not tied to your paycheck or your title. The work you've done still matters, even if it didn't go viral, even if the grant didn't get renewed. What to do next? Firstly, reflect. Write down 3 moments when you felt most aligned in your public health journey. What values were present? What were you doing? Who were you helping? How did you feel? 2, reconnect. Join a space that gives you room to be honest about your mess and the hope. Join our newly launched Discord community, free link below. 3, reset your approach. Look at the roles outside of government and academia. Explore policy, philanthropy, social impact organizations, media, health tech. Your skills stretch further than you think. You're not behind, you are becoming. And we're still in this together. Please hit that like button, hit that subscribe button, and share this with someone who gets some value from it. Hey there, before you go, if you've been enjoying the Public Health Careers podcast and want to help me keep creating these episodes as well as other content on the Public Health Millennial platform, I'd love for you to join the Public Health Millennial Cousins on Patreon. For just $8 a month, you'll get access to exclusive monthly live Q&A with me, updates, early access to resources, discounts, and more. Plus, you'll be supporting free career tools and stories for thousands of public health professionals. You can join the Patreon below or at patreon.com/the public health millennial. That's patreon.com/the public health millennial. Thanks for being a part of this community, and I'll see you in the next episode. And join the free community below if you aren't ready for the Patreon. See you all later. Peace.